They joked that she was just backup, that her bag was for bruises, not bullets. Then the explosion ripped through the field, and as the smoke cleared, only she was still standing, calm, steady, saving lives with bare hands and no time to think. From which city in the world are you watching this video today? If this story intrigues you, subscribe for more untold tales of those who serve in ways we never see. The worn leather handles of Dr. Sarah Chen's medical bag had been polished smooth by countless hours of carrying, the heavy weight of surgical instruments and emergency supplies creating permanent indentations in her shoulders that served as daily reminders of her commitment to battlefield medicine in environments where traditional medical facilities were luxuries that combat operations could not afford. At 0630 hours, Forward Operating Base Kilo was experiencing the deceptive calm that characterized dawn operations in hostile territory, populated by infantry soldiers and tactical support personnel who had grown accustomed to the presence of medical officers whose primary function was maintaining unit readiness rather than engaging in the direct combat operations that defined their mission parameters. To most of the soldiers in Bravo Company, Dr. Chen represented necessary but secondary support, a Harvard-educated trauma surgeon whose pristine medical credentials seemed almost comically overqualified for a deployment that primarily involved treating minor injuries, routine illnesses, and the occasional training accident that occurred when elite soldiers pushed their physical capabilities beyond normal safety margins. Her medical bag, meticulously organized with trauma supplies and surgical instruments that reflected years of emergency room experience in urban hospitals, had become the subject of good-natured ridicule among combat veterans who viewed medical preparedness as acknowledgement of weakness rather than practical necessity. "Doc's got everything in there except a kitchen sink," Staff Sergeant Rodriguez would joke during morning briefings, his commentary reflecting the casual dismissiveness that characterized how combat soldiers typically viewed medical personnel whose battlefield experience was limited to controlled environments where casualties arrived via helicopter rather than being created by direct enemy contact. Probably has a whole operating room packed in that bag, just waiting for someone to get a splinter. The other medics assigned to Forward Operating Base Kilo had learned to travel light, carrying basic supplies and relying on evacuation procedures to handle serious casualties that required more than field dressings and pain medication. Dr. Chen's insistence on maintaining comprehensive trauma capabilities, including surgical instruments and advanced life support equipment that added significant weight to her gear, was viewed as academic overthinking by personnel whose experience suggested that battlefield medicine was primarily about stabilization and evacuation rather than definitive treatment. Lieutenant Thompson, the platoon leader responsible for coordinating medical support during patrol operations, had initially questioned Dr. Chen's equipment selections during pre-deployment briefings, suggesting that her medical bag contained supplies that would never be used in field conditions that prioritized mobility and speed over comprehensive medical care. "Doc, you're not going to be performing heart surgery out there. Basic trauma supplies and good evacuation procedures are what keeps soldiers alive in combat zones." Dr. Chen's response had been characteristically diplomatic, acknowledging the lieutenant's experience while maintaining her commitment to medical preparedness that reflected years of training in emergency situations where comprehensive supplies meant the difference between life and death for patients whose injuries exceeded basic field treatment capabilities. "Lieutenant, I understand the mobility concerns, but trauma surgery principles don't change based on location. Sometimes comprehensive supplies are the only thing standing between a wounded soldier and permanent disability or death." The ongoing debate about medical preparedness had become a recurring theme during unit briefings, with combat veterans arguing for streamlined medical support and Dr. Chen advocating for comprehensive trauma capabilities that could address serious injuries without relying entirely on evacuation. Procedures that might not be available during extended operations in hostile territory. Corporal Martinez, a decorated combat medic with 3 deployment tours, had been particularly vocal about Dr. Chen's medical philosophy, suggesting that her civilian hospital experience had not prepared her for the realities of battlefield medicine, where speed and mobility were more important than comprehensive treatment capabilities. "Doc's thinking like she's still in Boston General, where she's got all the time and equipment in the world. Out here, you patch them up and ship them out. That's how you save lives in combat." Dr. Chen had listened to these criticisms with professional patience. Understanding that experienced soldiers had valid concerns about operational efficiency, while recognizing that her medical training had prepared her for emergency situations that might not fit standard battlefield protocols. Her medical bag represented years of emergency room experience, where comprehensive preparedness had saved lives that would have been lost with limited supplies and basic treatment options. The morning of October 15th began with routine patrol preparations, as Bravo Company prepared for reconnaissance operations in Sector 7 that involved establishing observation posts and gathering intelligence about enemy movement patterns in areas where previous patrols had reported minimal hostile activity. Dr. Chen conducted pre-mission medical briefings that covered standard trauma protocols and evacuation procedures. Her comprehensive preparation routine viewed as excessive by soldiers whose experience suggested that routine patrols rarely resulted in serious casualties requiring advanced medical intervention. "Doc's doing her full lecture again," Private Johnson whispered to his squad mate during the medical briefing, his commentary reflecting the casual attitude toward medical preparation that characterized soldiers who had completed multiple patrol operations without encountering serious enemy contact or significant casualties requiring more than basic first aid treatment. Dr. Chen's briefing covered trauma assessment procedures, surgical intervention protocols, and advanced life support techniques that seemed unnecessarily complex for patrol operations that were expected to involve minimal risk and routine intelligence gathering in areas where enemy activity had been limited to occasional sniper fire and improvised explosive devices that typically resulted in minor injuries rather than life-threatening trauma. The patrol departed forward operating base Kilo at 0800 hours, with Dr. Chen positioned in the middle of the formation where medical personnel were traditionally placed to provide optimal access to casualties while maintaining protection from enemy contact that might target medical support as high-value personnel whose loss would significantly impact unit capability and morale. Staff Sergeant Rodriguez led the patrol through terrain that had been cleared multiple times during previous operations, following established routes that provided good visibility and cover while avoiding areas where intelligence reports had indicated possible enemy activity or improvised explosive device placement that could threaten personnel and equipment during routine movement operations. "Quiet morning, Doc," Rodriguez commented as the patrol established its first observation post, his casual confidence reflecting experience with similar operations that had consistently resulted in minimal enemy contact and routine intelligence gathering without significant incidents requiring medical intervention or emergency evacuation procedures. Dr. Chen acknowledged the observation while conducting routine equipment checks that ensured her medical supplies remained properly organized and immediately accessible in case patrol conditions changed unexpectedly and comprehensive trauma care became necessary without warning or preparation time. The first indication that October 15th would not be a routine patrol came at approximately 1030 hours, when Private Williams reported movement in the tree line that suggested possible enemy observation or preparation for contact that could escalate from reconnaissance to direct engagement without sufficient warning to implement standard defensive procedures. "Contact possible. 2 o'clock. Williams reported through radio communications, his voice carrying the controlled tension that characterized soldiers who had identified potential threats requiring immediate assessment and possible tactical response to prevent enemy forces from achieving surprise or tactical advantage. Lieutenant Thompson immediately implemented contact procedures that involved establishing defensive positions and confirming threat assessment while maintaining communication with forward operating base Kilo regarding possible enemy activity that might require additional support or evacuation capabilities if contact resulted in casualties requiring medical treatment. Dr. Chen positioned herself in cover that provided protection from possible enemy fire while maintaining access to patrol personnel who might require immediate medical attention if contact escalated to direct engagement with enemy forces equipped with weapons capable of causing serious trauma requiring immediate surgical intervention. The enemy contact began with sniper fire that forced the patrol into defensive positions, while Thompson coordinated with base operations to request additional support and clarify rules of engagement for responding to hostile activity that threatened mission completion and personnel safety during what had been planned as routine reconnaissance operations. Single sniper, effective range approximately 400 meters, Corporal Martinez reported, while providing suppressive fire that allowed patrol members to establish better defensive positions and assess the tactical situation without exposing personnel to unnecessary risk from enemy weapons. Dr. Chen observed the tactical situation while maintaining readiness to provide immediate medical support, her comprehensive medical supplies suddenly seeming more appropriate for operations that might result in serious casualties requiring advanced trauma care rather than basic first aid and evacuation procedures. The tactical situation escalated rapidly when additional enemy forces joined the engagement, transforming routine patrol operations into sustained combat that required all available personnel to participate in defensive operations while maintaining communication with Forward Operating Base Kilo regarding immediate support requirements and possible evacuation procedures. Multiple contacts, automatic weapons, requesting immediate support, Lieutenant Thompson reported, while coordinating defensive fire that prevented enemy forces from advancing to positions where they could effectively engage patrol personnel with small arms and possible explosive devices. Dr. Chen remained in position while monitoring radio communications that indicated the tactical situation was developing beyond routine contact into sustained engagement that might result in casualties requiring immediate medical attention under combat conditions that would test her trauma care capabilities and equipment preparedness. The improvised explosive device detonated at 1,047 hours with devastating effect that transformed the tactical situation from manageable combat engagement to mass casualty event requiring immediate medical response under conditions that offered no possibility of evacuation or additional medical support from Forward Operating Base Kilo. The explosion occurred when Corporal Martinez attempted to advance to a position that would provide better fields of fire against enemy forces, triggering a device that had been positioned to target personnel attempting to improve tactical positioning during combat operations. The blast effect created immediate casualties requiring trauma care that exceeded basic first aid capabilities and demanded immediate surgical intervention to prevent death from blood loss and shock. Dr. Chen's response was instantaneous and professional, moving immediately toward the blast site while conducting rapid assessment of casualties and tactical situation that would determine medical priorities and treatment options under combat conditions that continued to threaten personnel safety and mission completion. The scene that confronted Dr. Chen represented the kind of mass casualty situation that her medical training had prepared her to handle, but which most battlefield medical protocols assumed would be managed through immediate evacuation to facilities with comprehensive surgical capabilities rather than field treatment with limited supplies and equipment. Corporal Martinez had sustained severe lower extremity trauma from the blast, with arterial bleeding and possible compartment syndrome requiring immediate surgical intervention to prevent permanent disability or death from blood loss and shock. Private Williams had suffered penetrating chest trauma from blast fragments, requiring immediate assessment for pneumothorax and possible cardiac injury that could prove fatal without immediate medical intervention. Staff Sergeant Rodriguez had been positioned close enough to the blast to sustain significant head trauma and possible traumatic brain injury that required immediate assessment and treatment to prevent secondary injury from increased intracranial pressure and cerebral edema that could result in permanent neurological damage or death. Lieutenant Thompson had sustained multiple fragment wounds and possible internal injuries that required comprehensive trauma assessment and treatment that exceeded basic first aid capabilities and demanded immediate surgical intervention under field conditions that offered no possibility of evacuation or additional medical support. Dr. Chen's medical training took control of the situation with systematic efficiency that prioritized casualties based on injury severity and treatment requirements while maintaining awareness of tactical situation that continued to threaten personnel safety and could interrupt medical treatment at any moment without warning. "I need immediate cover and security while I work," Dr. Chen announced while beginning rapid trauma assessment of casualties, her voice carrying the authoritative confidence that characterized medical professionals who had assumed command responsibility for emergency situations requiring immediate decision-making and surgical intervention. Private Johnson, the least seriously wounded patrol member, established defensive position that provided security for medical treatment while monitoring tactical situation for enemy activity that might threaten Dr. Chen's ability to provide comprehensive trauma care under combat conditions. Dr. Chen's medical bag, which had been the subject of months of good-natured ridicule for its comprehensive supplies and excessive weight, suddenly represented the difference between life and death for multiple casualties whose injuries required immediate surgical intervention with equipment that was not available through standard battlefield medical protocols. The surgical clamps and arterial forceps that Staff Sergeant Rodriguez had joked about as unnecessary academic equipment became essential tools for controlling massive arterial bleeding that would have resulted in death within minutes without immediate surgical intervention that exceeded basic field medicine capabilities. Dr. Chen worked with systematic precision that reflected years of emergency room experience, establishing airway control for Private Williams while simultaneously applying direct pressure to Corporal Martinez's arterial bleeding and monitoring Lieutenant Thompson's neurological status for signs of increased intracranial pressure requiring immediate intervention. Johnson, I need you to maintain pressure on this wound while I establish for access, Dr. Chen directed while organizing medical supplies that had been carefully selected for exactly this type of emergency situation where comprehensive trauma care determined survival outcomes for multiple casualties. The chest tube insertion that Dr. Chen performed on Private Williams required surgical instruments and technique that represented advanced trauma care capabilities that were not typically available during field operations, but which her comprehensive medical preparation had made possible under circumstances that would have resulted in death with standard battlefield medical protocols. Corporal Martinez's arterial repair required microsurgical technique and instruments that reflected Dr. Chen's civilian hospital experience with complex trauma cases, demonstrating that her academic medical background had prepared her for emergency situations that exceeded the expectations of combat veterans who had questioned her equipment and training philosophy. Lieutenant Thompson's neurological assessment required diagnostic capabilities and treatment options that Dr. Chen had insisted on maintaining despite criticism about excessive medical preparation, her comprehensive approach to battlefield medicine proving essential for managing casualties whose injuries exceeded basic first aid capabilities. The enemy forces withdrew from contact approximately 30 minutes after the explosion, apparently convinced that the blast had eliminated the patrol's operational capability and that continued engagement was unnecessary for achieving their tactical objectives. This cessation of hostile activity allowed Dr. Chen to continue comprehensive trauma care without interruption from enemy fire that could have prevented life-saving medical interventions. Dr. Chen's trauma surgery continued for over 2 hours under field conditions that tested every aspect of her medical training and equipment preparation, requiring surgical technique and decision-making that reflected years of emergency medicine experience adapted to combat environment that offered none of the resources typically available for complex medical procedures. The fluid resuscitation that maintained Corporal Martinez's blood pressure during arterial repair required supplies and monitoring equipment that Dr. Chen had included in her medical bag despite criticism that such comprehensive preparation was unnecessary for battlefield operations that typically relied on evacuation rather than definitive medical treatment. Private Williams's chest tube management required ongoing assessment and adjustment that demonstrated Dr. Chen's understanding of thoracic trauma principles applied under field conditions that would have made standard evacuation procedures impossible due to enemy activity and tactical situation that prevented helicopter operations. Lieutenant Thompson's neurological monitoring required diagnostic capability and treatment protocols that reflected Dr. Chen's comprehensive medical training adapted to emergency situations where patient outcomes depended entirely on immediate medical intervention without possibility of specialist consultation or advanced diagnostic equipment. The medical evacuation helicopter finally arrived at 1,330 hours. After enemy forces had withdrawn sufficiently to allow safe landing and patient transport to forward operating base Kilo, where additional medical support could provide continued care for casualties whose immediate survival had depended entirely on Dr. Chen's comprehensive trauma care capabilities. Corporal Martinez was evacuated with stable vital signs and controlled bleeding that had been achieved through surgical intervention that would not have been possible with standard battlefield medical supplies. His long-term prognosis significantly improved by immediate arterial repair that prevented permanent disability and possible death from blood loss. Private Williams was transported with functioning chest tube and stable respiratory status that reflected successful management of penetrating thoracic trauma under field conditions. His survival directly attributable to Dr. Chen's comprehensive medical preparation and advanced trauma care capabilities that exceeded standard battlefield protocols. Lieutenant Thompson was evacuated with stable neurological status and controlled intracranial pressure that had been managed through immediate medical intervention using diagnostic and treatment capabilities that Dr. Chen had maintained despite criticism about excessive medical preparation for routine patrol operations. Staff Sergeant Rodriguez, who had frequently joked about Dr. Chen's comprehensive medical bag and academic approach to battlefield medicine, was among the first to acknowledge that her medical preparedness had saved lives that would have been lost with standard battlefield medical protocols and equipment limitations. "Doc, I owe you an apology," Rodriguez said during post-mission debriefing, his voice reflecting genuine respect and recognition that Dr. Chen's comprehensive medical philosophy had proven essential for managing casualties whose survival had depended on immediate surgical intervention under combat conditions. "Your bag didn't just save lives today, it saved my life specifically. I was wrong about academic medicine not being practical for battlefield conditions." Lieutenant Thompson's recovery included formal recognition that Dr. Chen's medical intervention had prevented permanent neurological damage that would have resulted from delayed treatment. Her comprehensive approach to battlefield medicine proving that academic medical training could be successfully adapted to combat conditions that required immediate surgical decision-making. Private Williams's complete recovery from penetrating chest trauma was directly attributable to Dr. Chen's immediate surgical intervention and ongoing thoracic management under field conditions, demonstrating that comprehensive medical preparation could achieve outcomes that exceeded standard battlefield medical expectations and capabilities. Corporal Martinez returned to full duty after rehabilitation that was significantly shortened by Dr. Chen's immediate arterial repair, his functional recovery reflecting the difference between comprehensive trauma care and basic first aid protocols that would have resulted in permanent disability or possible death from blood loss and shock. The official after-action report documented Dr. Chen's medical performance as exemplary trauma care under combat conditions, noting that her comprehensive medical preparation and surgical capabilities had achieved patient outcomes that exceeded expectations for battlefield medicine and demonstrated the value of academic medical training adapted to military operational requirements. Dr. Chen's medical bag, which had been the subject of months of criticism for excessive weight and unnecessary supplies, became the standard for forward medical support throughout the brigade, with other medical officers adopting her comprehensive approach to trauma care preparation and equipment selection for combat operations. The surgical instruments and advanced medical supplies that had been dismissed as academic overkill became required equipment for medical personnel supporting combat operations where evacuation might not be immediately available, and comprehensive trauma care could determine survival outcomes for casualties with life-threatening injuries. Dr. Chen's integration into Bravo Company culture changed significantly after October 15th, with soldiers who had previously viewed her as overprepared academic now recognizing her as essential combat support whose medical capabilities had proven decisive for unit survival and mission success under conditions that tested every aspect of military medical preparedness. "Doc doesn't carry backup supplies," Staff Sergeant Rodriguez would explain to new personnel during medical briefings, his perspective transformed by direct experience with comprehensive trauma care that had saved lives under combat conditions. "She carries life-saving equipment that makes the difference between coming home alive and not coming home at all." 3 months later, Dr. Chen was awarded the Bronze Star Medal for her medical performance during the October 15th engagement, with the citation specifically noting her comprehensive trauma care under combat conditions and her role in saving multiple lives through immediate surgical intervention that exceeded standard battlefield medical protocols and capabilities. Dr. Chen's medical philosophy had been vindicated by combat experience that demonstrated the value of comprehensive preparation for emergency situations where patient outcomes depended entirely on immediate medical intervention with advanced trauma care capabilities that could not be provided through basic first aid and evacuation procedures. The leather handles of Dr. Chen's medical bag continued to bear the weight of comprehensive medical supplies, but the burden now carried different meaning. Recognition that battlefield medicine required academic excellence adapted to combat conditions rather than simplified protocols that assumed immediate evacuation and advanced medical facilities would always be available for serious casualties. Dr. Sarah Chen had proven that medical preparedness transcended traditional battlefield medicine limitations, demonstrating that comprehensive trauma care could save lives under combat conditions when academic medical training was properly adapted to military operational requirements and supported by equipment selection that prioritized patient outcomes over operational convenience and weight considerations.